Hi, I'm Kira. I'm one of the sex educators with Uberlube, and I've had the honor and pleasure of representing this amazing product at medical, nursing, and sex therapy conferences all over North America and Europe for the last several years. First of all, thank you for talking to your patients about sex. It is so important that regardless of your patient's age, gender identity, sexual orientation, everyone is aware of their options when it comes to their sexual health, particularly the existence of something like a silicone lubricant. Most people don't even know about silicone lubricant. They think of lube as only being water-based. And water-based can be great and perfectly sufficient for many folks. However, it does not last very long, and it can contain some products that may be harmful to some of your patients. Uberlube contains only 4 products, 3 types of a pure high-grade silicone and a trace amount of vitamin E, and that is everything in this bottle. It contains no glycerin, no parabens, no gluten, no fragrance, no flavoring, and as you can see, no coloring either. This is great for folks with sensitivities to other kinds of lubricant. One of the reasons for that is that silicone is biostatic. Any sort of bacteria, mold, yeast cannot grow in this product. So not only is that a good thing in the sense of this can sit on someone's shelf for a long time and it won't grow anything nasty, but also we don't have to put preservatives into our product to keep bacteria down, unlike any water-based lubricant. So this is safer for folks who may have an allergy or a sensitivity to preservatives and tend to find that they don't react well with water-based lubricant. The 2 main concerns with lube that healthcare professionals are taught is pH and osmolality. The pH of Uberlube is 4.6 on the acidic side, which is what you want for a vaginal lubricant, and the osmolality is something that you actually don't have to worry about with a silicone lubricant, particularly for people who are prone to yeast infections, changes in their pH, changes in bacteria, or they have fairly fragile vaginal tissue in which the cells are at risk of shrinking and sloughing off. A silicone lubricant would be the way to go. A couple of medical myths to dispel about silicone lubricant. It is in fact compatible with both latex and polyisoprene condoms. It is not compatible with polyurethane. In general, I wouldn't recommend polyurethane condoms to your patients, but it is compatible with other types of condoms. When it comes to sex toys, I would not recommend a silicone lube with a silicone sex toy. However, you can have your patients spot test the lubricant on the underside of the toy, and if they notice that it starts to swell or bubble or flake at all, just use some soap and water and wash it off. So if you would like to order a clinician's kit, it comes with 200 of these things that we call foils. Each foil is about 2 milliliters of Uberlube. Your patients can take one home, tear it open, and use it once, and see how they like it before they buy. We will also send you 2 of these 50 milliliter bottles. Now these are excellent ways to give your patients a test of the lubricant just on their hands right there in the office. This is a metered pump, so what that means is you don't need to do a full pump of the lubricant every time you want your patient to sample it. You can do a half pump, a quarter pump. What I would do is I would ask the patient to present their wrist, as this is a sensitive part of the skin, and I would do maybe a quarter pump on their wrist. And then I would ask them to, with that tiny little bit of lubricant, I would ask them to just take their finger and start moving it in a circle. What they will notice is that it's not sticky, it has no smell, it has no taste, it doesn't leave them feeling goopy, it doesn't run right down their arm, it pretty much stays in place, and it works as long as they are using it. At this point, they may ask you for a tissue. Now, instead of giving them a tissue, I want you to actually say, just leave your hands exposed to the air for a couple minutes. Because after a couple minutes, it will actually dissipate. It does not sink into the skin, as silicone does not actually penetrate the cell membrane. Instead, it dissipates across the surface of the cells, giving the sensation of a nice, clean finish. It feels like something is there, but nothing sticky, nothing goopy, nothing that will stain one's clothing. The other thing about silicone lubricant is because it lasts such a long time, you don't need to use as much of it. So even a small bottle like this can last your patient a long time. This also can be an excellent anti-chafe for patients who may be overweight. They may experience chafing, particularly in warmer months. This can help to protect their skin. I may recommend that they carry a travel size with them so that they can reapply throughout the day, just in case they're sweating it off of their bodies. We sponsor an ultramarathon runner who anecdotally has assured us that this will last through a marathon. So if that's not a testimonial for you, I don't know what is. Ours has a very clean packaged look. It's very discreet. It doesn't look scary or intimidating to patients, and it can be a bit of an easier sell than some other brands. So in summation, regardless of the type of patient population that you have, Uberlube will be a valuable addition to your clinic. Something to know about this company is that it is a very small family-run business, and we like to have personal relationships with each one of our clients. So if there is anything that you need, let's say you dropped your tester bottle on the clinic floor and it's shattered, just reach out to us and we'll send you another one, no questions asked. If you would like us to send you more of these samples, they've gone like hotcakes, we're happy to send you more. It's not at all a one-time deal. We like to have an ongoing relationship. If you would like one of these beautiful posters to put up in your clinic, we will happily do that as well. We could even customize it to speak directly to the type of patient that you tend to see. And thank you so much.